Hi guys, welcome to Clinical Centric. Today we are going to talk about Dolonex injection. That is basically a Piroxicam injection, the main salt is. And in this video we are going to talk about its contraindications, uses, side effects, doses and some preventions. So without any delay, let's start the introduction first. So Piroxicam marketed under the brand name of Dolonex. Dolonex is a product of Dr. Reddy Pharma. It is a NSAID drug, that is non-steroidal anti-inflammatory drug, that is used to relieve pain and inflammation associated with various conditions such as arthritis. So first of all, let's know uses of this drug. So first use of this injection is management of osteoarthritis and rheumatoid arthritis. And second is relief of mild to moderate pain. Third is treatment of acute musculoskeletal disorders. And next we are going to talk about its doses and administration. So adult dose of this injection is 20 mg per day maximum. And this injection is administered only IM, and alternatively 10 mg twice a day may be administered if the pain is severe or patient is feeling a severe pain. And the maximum dose of this injection is 20 mg per day only. And this injection can be administered intravenous also, but this should be diluted in the water or distilled water and should be administered IV within the gap of 15 to 20 seconds. And the pediatric dose of this injection is not recommended for the children under the age of 12 year age. And in adult patients, it should use with caution. Start with the lower end of the dosing range. And next we are going to talk about contraindications of Piroxicam injection. So first contraindication is hypersensitivity to Piroxicam or other NSAIDs. And second is history of asthma, urticaria or allergic type reaction after taking aspirin or other NSAID. And third is active history of peptic ulcer or gastrointestinal bleeding. And next is severe heart failure, severe renal or hepatic impairment. And next contraindication is used in the third trimester of the pregnancy. And now we are going to talk about warnings and precautions of this Piroxicam injection. So first warning is monitor for sign of gastrointestinal bleeding, especially in the elders. And use with caution in patient with a history of cardiovascular disease patient. And monitor liver and kidney function periodically. And next is avoid use in patients with severe heart failure unless absolutely necessary. And now let's talk about side effects of Dolonex injection. So common side effects are GI disturbance like nausea, vomiting, dyspepsia, dizziness, headache and rashes. And some serious side effect may also be happen. So serious side effect like gastrointestinal bleeding or ulceration, hepatotoxicity, nephrotoxicity or severe allergic reaction, that is anaphylaxis. And next is cardiovascular thrombotic events, that is heart attack or heart stroke. And next is drug interactions. So avoid concomitant use with other NSAID or corticosteroids due to increased risk of gastrointestinal bleeding. And next is may enhance the effect of anticoagulant, that is warfarin, and increase bleeding risk. And next side effect is it can reduce the efficacy of antihypertensive drug, that is ACE inhibitor or diuretics. And next side effect is monitor lithium level as NSAID can increase serum lithium level. And the most important part is patient consent information. Inform patient about the risk of gastrointestinal bleeding and advise them to report any sign of bleeding, that is black or bloody stool, vomit that looks like coffee grounds. And next is advise patient to take the medication with the food or milk to minimize the gastrointestinal discomfort. And next is instruct patient to avoid alcohol as it may increase the risk of gastrointestinal bleeding. And next is inform patient about the sign of serious cardiovascular events and advise them to seek immediate medical attention if they experience symptoms such as chest pain, shortness of breath or weakness. And now let's talk about storage of this injection. So it should store at the temperature of 20 to 25 degrees centigrade and protect from direct sunlight and moisture, and store it in a dark place. So this is a brief summary of Dolonex injection or Piroxicam injection. So I hope you like the video. If you like the video, please subscribe the channel and turn on the bell icon